Have you ever experienced a morning where you noticed something peculiar about your body? Perhaps it was an unexpected drop in weight, a strange discomfort that seemed to appear out of nowhere, or waking up soaked in sweat without any obvious explanation. What if I informed you that specific indicators in the morning might serve as your body's method of signaling an early warning that something significant, such as cancer, could be in the process of developing? Many individuals tend to disregard the subtle cues their bodies present, often attributing them to the natural aging process. However, overlooking these indicators may result in lost opportunities to identify potential health issues early when they remain manageable. In this video, we will explore 4 important signs that may suggest a significant risk of cancer. Some of these may come as a surprise, while others might resonate with your observations of yourself or someone close to you. By the conclusion of this video, you will be equipped with the knowledge to identify these warning signs and, most crucially, comprehend the appropriate steps to take next. Remain attentive until the conclusion, as you will uncover the connections between these symptoms, their significance, and the necessary actions to take should you encounter them. This could be crucial information for your well-being. If you haven't subscribed yet, I strongly advise you to do so and activate the bell notification to ensure you never miss essential health updates like this. Now, let us proceed with our exploration. Persistent cough or hoarseness. A persistent cough or a hoarse voice that fails to improve may indicate a serious condition, particularly in older adults. A persistent cough that lasts for weeks or months, unlike the temporary coughing associated with a cold or seasonal allergies, may suggest a more serious underlying condition, such as lung or throat cancer. This symptom is frequently associated with malignancies of the lungs, throat, or larynx. This symptom can be especially worrisome for older adults, as it is occasionally confused with typical respiratory infections. Nonetheless, should the cough remain persistent and progressively worsen, it may indicate that a mass is exerting pressure on the airways or obstructing them, resulting in breathing difficulties and contributing to the ongoing cough. Furthermore, hoarseness in the voice may indicate that a tumor is impacting the vocal cords or the nerves in the throat. An illustrative case is that of George, a 72-year-old gentleman who has been suffering from a persistent dry cough and hoarseness of voice for several months. At first, he believed it was merely a persistent cold. However, the symptoms failed to show any signs of improvement. When George went for his appointment, an X-ray showed a tumor in his lung that was pressing against his vocal cords and airways. Regrettably, this condition has advanced considerably. When diagnosed, the connection between a persistent cough and lung or throat cancer must be regarded with utmost seriousness. Should you encounter a persistent cough, trouble with breathing, or alterations in your voice, particularly if these symptoms endure beyond 3 weeks, it is essential to seek medical attention without delay. Timely identification can significantly impact the success of therapeutic interventions. It is advisable not to delay until the symptoms escalate. Persistent morning fatigue that remains unchanged despite adequate rest. Waking up in the morning ought to leave you feeling revitalized or, at the very least, somewhat improved compared to when you went to bed. However, if you find yourself awakening feeling just as fatigued, if not more so than the previous night, it may indicate that there is more at play than merely a poor night's rest. Medical professionals caution that ongoing morning fatigue, even with adequate sleep, may serve as an early sign of cancer. Cancer-related fatigue is distinct from regular tiredness. It manifests as an intense feeling of exhaustion that does not alleviate with sleep or rest. This particular form of fatigue frequently arises when the body reallocates energy to combat an internal illness that is developing. Blood cancers such as leukemia and lymphoma are recognized for inducing significant fatigue, which is often most apparent in the morning when the body is expected to feel revitalized. These cancers impair the body's capacity to generate healthy red blood cells, resulting in anemia, which is a significant contributor to ongoing fatigue. However, it extends beyond just blood-related malignancies. Lung malignancy, liver cancer, and colon cancer may result in systemic inflammation, which can interfere with sleep patterns and lead to profound, persistent fatigue. It is a common misconception that morning fatigue is merely a natural consequence of getting older. However, when this tiredness persists for an extended period and is associated with additional symptoms like dizziness, loss of appetite, or unexplained fluctuations in weight, it warrants further investigation. Consider the situation of George, a 74-year-old gentleman who enjoys commencing his day with a morning walk. He started to observe that regardless of how early he retired for the night, he consistently awoke feeling fatigued. Initially, he believed it was merely the effects of aging that were beginning to manifest. However, as the weeks progressed, the fatigue intensified. Even minor activities such as preparing breakfast seemed to require an overwhelming amount of effort. A medical examination indicated that he had undiagnosed leukemia, which was significantly impacting his energy levels. Due to the early detection, the treatment proved to be significantly more effective. Today, he experiences a sense of strength that surpasses what he has felt in many years. If you find yourself waking up each morning feeling fatigued despite a full night's rest, it is crucial to take note of this. Monitor the duration of your tiredness. Observe any additional atypical symptoms and consult with your healthcare provider. Persistent fatigue may serve as an early indicator that there are significant underlying issues that require attention. If you are continuing to engage with this video and appreciate the insights being shared, kindly comment with the number 2 below to indicate your presence. If you have not yet subscribed, I highly advise you to do so and activate the notification bell to ensure you do not miss any upcoming videos. Your assistance enables us to persist in producing valuable content that educates and motivates you. Let us proceed with the next steps. Unexplained morning sweats that result in significant dampness. Experiencing a sudden onset of perspiration upon waking may initially appear to be a common occurrence. It is a common misconception that this phenomenon is merely a response to elevated room temperatures or the weight of heavy blankets. However, when night sweats occur consistently and are excessively dampening the linens even in a cool environment, it may signal that a more serious issue is at play. It is advised that ongoing, unexplained morning sweats could suggest an underlying cancer, particularly if they are accompanied by additional symptoms. Some types of cancers, especially those like lymphoma, leukemia, and certain hormone-related cancers, may lead to excessive sweating. This occurs as cancer influences the immune system, leading to inflammation and disturbances in temperature regulation. Continuous activation of the immune system can result in symptoms such as fevers and night sweats as the body endeavors to combat what it identifies as a potential threat. However, what many individuals fail to understand is these sweats frequently remain undetected until they escalate to a more serious level. Numerous individuals tend to regard these issues as trivial disturbances, often attributing them to the effects of aging, stress, or menopause. What distinguishes night sweats associated with cancer is their severity. They are more than just mild perspiration, leaving you thoroughly soaked and necessitating frequent changes of clothes or bedding several times a week. Take, for instance, Richard, a 71-year-old retired teacher. He never paid much attention to his occasional night sweats until they began occurring every single night. He would occasionally awaken feeling damp, requiring a towel to dry off before rising from bed. Initially, he attributed his symptoms to the natural process of aging, believing it was simply another aspect of growing older. However, as he began to experience weight loss and persistent fatigue, he made the decision to seek medical advice. The examination indicated a diagnosis of lymphoma. Identifying it at an early stage had a profound impact on his treatment and overall recovery process. If you are experiencing morning sweats consistently and without an obvious reason, particularly if they are soaking your pajamas or sheets, it is important not to overlook this issue. Pay attention to the frequency of these episodes, especially if they are associated with weight loss or fatigue, and discuss your observations with a healthcare professional. This could be an indication that your body is trying to communicate that something may be amiss, potentially before other symptoms manifest. Additionally, consider unexplained weight loss occurring in the morning. Waking up to find your clothes fitting more loosely or noticing a drop in weight on the scale without any effort may initially appear to be a small change. However, it is important to be aware that unexplained weight loss, especially when observed in the morning, can be one of the earliest and most alarming indicators of cancer. The body continues to expend energy even while at rest. However, when an individual undergoes sudden and unintentional weight loss, it frequently indicates that the body is utilizing energy inappropriately, such as in the process of combating an emerging illness. Sudden weight loss is often associated with pancreatic cancer, which is one of the more prevalent types of cancer. The pancreas is essential in the digestive process as it produces enzymes that facilitate the breakdown of food. When cancer affects the body, its capacity to absorb nutrients diminishes, resulting in weight loss, muscle wasting, and a general sense of weakness upon waking. Gastrointestinal cancers, including those of the stomach and colon, can disrupt the body's food processing, leading to significant metabolic changes. However, weight loss is not solely attributed to cancers related to digestion. Lung cancer, lymphoma, and even advanced prostate cancer can lead to the release of inflammatory compounds known as cytokines, which accelerate metabolism and contribute to the breakdown of fat and muscle. If you observe a decline in your weight exceeding 5% over several weeks without any changes to your diet or physical activity, it is crucial to address this issue. Many individuals believe that weight loss is merely a natural consequence of aging. However, it is important to recognize that unexpected and unintentional weight loss, particularly when observed in the morning, should not be overlooked. Consider the case of Richard, a 72-year-old retiree who consistently maintained a stable weight. One morning, he observed that his belt had become looser. Initially, he dismissed it as a typical variation, but as the month progressed, he experienced a significant weight loss of nearly 15 pounds, all without any alterations to his dietary routine. A medical consultation and subsequent examinations indicated that he had early-stage stomach cancer. Due to the early detection, his treatment alternatives were significantly improved, and he is currently in good health. His narrative serves as a significant reminder that these minor adjustments in the morning routine can be crucial for identifying serious health issues promptly. If you have experienced unintentional weight loss, particularly if it is evident in the morning prior to your first meal, it is important to pay attention to this change. Maintaining a log of your weight and engaging in conversation about it with a healthcare professional could significantly impact your health journey. If you are currently engaged with this video and appreciate the insights being shared, kindly indicate your presence by commenting the number 4 below. If you have not yet subscribed, I highly encourage you to do so and activate the notification bell to ensure you do not miss any of our videos. Your support enables us to persist in producing valuable content designed to inform and inspire you. Now, let us proceed. Concluding reflections, essential insights, and forthcoming actions. In summary, there are 4 morning signs that may suggest a significant health issue, particularly the possibility of cancer. Unexplained weight reduction, ongoing discomfort related to blood and urine, persistent fatigue accompanied by a long-lasting cough or hoarseness. These signs should not be overlooked, and if they continue or escalate, it is essential to consult a healthcare professional. Timely identification is crucial for enhancing results in numerous cancer cases. Taking initiative regarding any alterations in your well-being can significantly impact your overall health. While it's crucial to keep in mind that these signs do not automatically indicate cancer, they can serve as warning signals that warrant a professional assessment. Our bodies frequently communicate with us when there is an issue, and being attentive to these signals can aid in identifying illnesses before they escalate into more serious conditions. For seniors, it is essential to uphold consistent wellness practices. Regular evaluations and maintaining awareness of symptoms can significantly contribute to the prevention or management of possible health concerns. Maintaining your well-being goes beyond merely steering clear of illness. It's essential to be knowledgeable and to make informed decisions for your health. If you have any concerns regarding the symptoms we talked about today, please ensure you arrange a consultation with your healthcare professional. They can provide direction on the subsequent actions and assist you in obtaining an accurate diagnosis and appropriate treatment if needed. Keep in mind that your well-being is a valuable investment. Do not delay until conditions deteriorate. We appreciate your presence today and would be eager to receive your feedback. Please take a moment to share in the comments one insight you gained today and how you intend to incorporate it into your daily life. Your insights hold significant value, so please feel free to express them. Your feedback provides us with significant motivation and encouragement. If you found this video beneficial, kindly consider liking, subscribing, and sharing it with others. Your assistance enables us to persist in producing valuable content that educates and motivates you. Thank you for your attention, and we anticipate your presence in our upcoming video.